Hi, I'm Tammy. I am from Arlington. We live on a farm just south of Arlington, and I am a retired nurse. I had cochlear implant and was doing very well. That was on a Tuesday. Well, I woke up Saturday morning at home and was having a lot of problems. Extreme vertigo. I couldn't even open my eyes. It was so bad. And trying to get me up was not in the cards. So my husband called the ambulance. They came and got me and brought me to the Brookings ER. And I am so glad they did. The nursing staff and everybody, they were great, because I was scared that having just the new implant, that this was causing the problem, which it was, but I was afraid they were going to have to take it out. To get to the point of needing one of those, you are basically deaf, even with hearing aids. The fact that this was going to give me my hearing back, it was scary to think I was going to lose it. And one of the things that made me feel better almost that quick was that they were calming, they were compassionate, they were caring, they were taking care of me, not just physically, but emotionally. And they were so good at being calming, and it's okay, everything's gonna be fine. Your implant looks good. Everything looks good, we're gonna do some tests. When Abby and my husband tried to stand me up, I couldn't stand up by myself. And they just looked at each other and she said, she cannot go home. Being older and having some of the health problems I have, I am a high fall risk. And yes, I've fallen and broken bones. I don't need that anymore. I don't need to do that. They looked at me and said, wait a minute, this is not safe for her to go home. We need to get her safe. What do we need to do it? And she hooked me up with physical therapy. The problem what I came in with was the severe vertigo due to inflammation. Once we got that under control, it was just getting me strong enough to get back. They had physical therapy work with me, and they got me up walking with the walker and stuff like that. And the physical therapists were fantastic. So I stayed another night, but that night, the aides, or the patient care techs, they helped me get up and they helped me walk around, and we walked, and I was going to get my strength back. I was going to do what I had to do. And by golly, by the next day when she came in, I said, I'm ready. And we got up and we walked further than I had the whole time, and was able to get up and down the stairs. When I went home, I was much safer. And yes, they made sure that I had a walker at home, which I did, and a shower chair and everything that would keep me safe. And we had everything in place, and I went home and did fantastic. I had Abby CNP. She was amazing. She answered all my questions. She alleviated so many fears. Even as a nurse with 30 plus years of experience, when you're a patient, it's completely different. She was always there. Is there anything else I can do for you? What about your other meds? And we'd went through everything. There wasn't anything that she didn't know, or that I wasn't afraid to even tell her. You know, this is how it is. It's so easy to talk to. You know, that's been one of the big things I've noticed too about the Brookings Health System, is that everybody's easy to talk to. She is amazing. She has such a positive, sunny disposition to begin with. She likes to sit and listen to you. If there's any concern, she will sit there and discuss it with you. She just won't get up and make the decision on her own. She makes the decision with you. She knew exactly what needed to be done. And I just can't believe how nice and friendly and cheerful. It was such a good experience for being in the hospital. It was a very good experience. I can't stress that enough because it was amazing. And I'm going to tell you, just from personal experience, this hospital stay, nobody wants to be in the hospital, but if you have to be, this is the place to be. Made me feel so special. And I had never felt that before in a hospital before. But these people really made me feel special. They weren't afraid to say hi. They weren't afraid to say, "Hi, how you doing?" And that's very important. Even just a pat on the hand is very important. It's the fact that that's a human touch, and people need that. I always believed that as a professional, you should have an idea of what you see are the important elements that should be taken into consideration no matter what you're doing. For me, I have my 3 C's, and that's caring, compassion, and communication. With those 3 things, you can build that bond and you can build that trust with your patients or clients. There's been so many places I have been so disheartened by healthcare because of some of the changes I've seen where that's just thrown out. Everything has become about the bottom line. But being here, that caring, that compassion, that communication, it was embodied here. It was like they were reading my mind and understood how I felt about how healthcare really should be. This healthcare system just makes me feel good about healthcare again.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.